officials are sounding the alarm about the possibility of fake Botox that could be the reason at least 4 people in Tennessee were sick with botulism-like symptoms. Here to discuss how to stay safe from fake Botox and the latest health headlines is primary care physician and public health specialist, Dr. Saju Mathew. Doctor, welcome.
Hi, Hena. Good morning.
Good morning. So the CDC launching an investigation into these fake Botox cases. Tell us more.
Yeah, so here's the deal. Overall, I want to be upfront and clear that most Botox administrations are actually safe. But in this particular case, 2 patients had an adverse effect, and that most likely, Hena, was from too much Botox given in the wrong parts of the face, causing extreme contraction, muscle tightness, and botulism-like symptoms. That's why it's important to make sure that you vet the person who's giving you the Botox. Make sure that it's a plastic surgeon's office or maybe even a dermatologist's office, and whoever's administering the shot has done this over and over again.
Do your research. I think that's such great advice. Doctor, very quickly, what are some of the symptoms of botulism?
Yeah, so difficulty breathing, difficulty swallowing, muscle tightness, facial drooping. Extremely important to realize that this is still very rare, but it can happen. And if it does happen, you should let your doctor know or go to the emergency room ASAP.
All right. I hope our viewers take a good look at these symptoms. Moving on to a study that I want to talk to you about. A group of women, working women, they were the ages of 40 to 60. 23% of them said they want to resign because of the impacts of menopause that they're feeling. What are the symptoms of menopause, sir?
Every patient can go through different symptoms. Some women, it's more severe than others, Hena. Patients that see me typically have night flashes, hot sweats, dryness, headaches, and mood swings. And what's important is as women compete with men in the workforce, it is important that human resource departments make sure that men especially are aware of what women go through and give women the support that they need. And when I see them at my office, I tend to put them on a low antidepressant that can help with hot flashes and help them feel better. Hormone replacement therapy is also an option if you are the right candidate.
Thank you for that. I have less than a minute. I want to talk to you about this other study in the U.S. that 41.9% of American adults are living with obesity. Researchers in Australia found that nighttime movement between the hours of 6 and midnight might be most beneficial to this group of obese people. Why is that, sir?
Yeah, so interesting. When it comes to obesity, I'm all excited. I'm all over it because I definitely think that when it comes to treating weight loss, it's more than just movement. But this particular study suggested that patients who are obese, who actually did maybe 30 seconds of high intense activity, it could be climbing up a flight of stairs, walking, sprint walking, and if they did that frequently as opposed to the duration of exercise, that they actually lost weight. But the bottom line here, Hena, is any type of movement is important, and always trying to raise your fitness level every week is key. But there's more to obesity: mental awareness, your mental well-being, talking to a psychiatrist, and of course, diet. But this is good. Any type of movement is better than no movement at all.
Absolutely. A lot of good points. Thank you for joining us this Sunday morning, Dr. Mathew. We appreciate it.
Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.